news is that most women that have GD are going to be able to manage this without any type of medication. Although you are going to need to really take your diet and those habits seriously. This certainly is not something to mess around with if you do get diagnosed.
Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau,
Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you're trying to conceive, pregnant, postpartum, or beyond, you're welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details. Welcome back to the Vibrantly You podcast. Today, we're going to be diving into a really important topic, gestational diabetes. So whether you are currently pregnant or you are planning to get pregnant in the near future, this is going to be a great episode for you. So let's get into it, Caitlin. Let's talk a little bit about gestational diabetes.
I think that navigating this can feel really scary and overwhelming for so many moms or moms to be. There's also just a lot of misconceptions around this on the internet, in mom Facebook groups. I don't know if you've seen that too, but it can be hard because your appointment times with your provider are often really limited. So if you get diagnosed with this, I think you can feel kind of blindsided, and it can be really hard to know what questions do I need to ask my provider in this very short window of time. So hopefully this conversation today can help empower you to really understand what is going on in your body, and it can allow you to have more meaningful conversations with your provider if this does or has come up in your pregnancy.
Yeah, I do think you're right. It's really overwhelming there, especially with social media. I feel like this has been a hot topic, especially lately. Do you do the glucose test? Do you not? What are the other options? There's just a lot of misinformation on the internet. So I'm really excited for this episode for you to really dive into the evidence and give people a clearer picture of what gestational diabetes is. And I even know for some of my clients, this is something that they're really nervous about, even in the beginning of pregnancy, worried that they're going to do something that's going to cause them to have gestational diabetes. So let's start with the basics. Can you explain what exactly it is and why it happens?
Yeah, so during pregnancy, our bodies become even more obsessed with regulating our blood sugar levels. And so gestational diabetes occurs when the pregnancy hormones interfere with insulin function, which then leads to higher blood sugar levels. So this is something that typically shows up in that second or third trimester, and research shows it affects about 2 to 10% of pregnancies. So again, I think that can sound really scary, but our goal is to manage it well and prevent complications for both mom and baby. So if you do end up developing GD during your pregnancy, the good news is that most moms, about 60% can manage this using nutrition and lifestyle changes. And then the other 40% may need other medications or insulin. So again, most and also afterwards, most of the time, the blood sugar levels are going to return to normal after you have delivery of baby. However, it is something that we want to still pay a close eye on. You should be following up with your provider about this during postpartum, as it can sometimes increase that risk of developing prediabetes or type 2 diabetes later in your life.
Yeah, and I do think this is really reassuring, like you said, that 60% of people can manage this with nutrition and lifestyle. I think that helps to kind of make it less scary, hopefully, and less overwhelming for people. So let's talk about the tests for gestational diabetes, because like I said before, this is something a lot of people are curious about. Let's get right into it.
Yeah, I think this is like you said, this is this testing piece is a really hot topic on the internet. So usually what happens is that between that 24 and 28 weeks of pregnancy, you're going to have your provider start off with that glucola drink, that glucose tolerance test. And again, this is like the part that is like the hot topic, but um, you know, this is something that, again, educate yourself on the options. And I'm going to talk about what some of those are. And really, every provider is going to be a little bit different. So, this allows you to have a meaningful conversation with your provider based on your values. The standard of care is to use that glucola drink. Both you and I had this first pregnancy. And I personally was like, really, really nauseous, and I thought I was going to puke after I drank it. But there are also alternatives. So there is a brand called the Fresh Test, and they have an alternative drink. It does not have any of the like preservatives or food dyes that are used in that original glucola drink, which is has gotten some like negative press regarding those issues currently. There are also like food alternatives like jelly beans, or some providers may be okay with you doing home glucose monitoring. But the idea is that this glucose test is going to see how your body handles sugar. And so you're going to have your blood drawn and they're going to check those numbers to see. Um, if you do your glucose challenge test and the blood sugar levels are higher than anticipated, your provider is going to do a follow-up test. And this is the oral glucose tolerance test, or the OGTT. And for this test, you are going to fast overnight, and then you're going to have your blood sugar levels checked before and after drinking like a stronger solution of glucose. So again, they're probably going to use glucola for this. I don't know that you're going to necessarily be offered another alternative here, although this may be varied provider to provider. But they're going to check your levels at 1, 2, and 3 hours after drinking that to see how your body is processing the sugar over
Yeah.
time. So
Yeah.
that's kind of the deal with the testing options.
Yeah, and I know that I like did both of those things. So I did the glucola
Yeah.
first pregnancy, and honestly, like, I had a fine experience. Like, I know people are, like, afraid of it. I didn't mind the taste, like, I felt okay generally. I mean, obviously, like, when you drink a lot of sugar in a very fast period, you do kinda get that little, like, sugar rush, so I do feel like I felt that. But, like, overall, I felt fine. But then,
Yeah.
yeah, with the second pregnancy, I just wanted to try the fresh test because 'cause I'd heard so much good things about it.
Yeah.
I thought that one was actually really tasty. I was like, "Can I drink this
Yeah.
all the time?
Yeah.
This is good."
I tolerated that much better. I think the glucola, whatever. Maybe it was just the flavor that I
Yeah,
had, but I just like could barely get it down, and I literally thought I was gonna puke it back up
yeah. Well, and I've
afterwards.
heard other
So
people say that too. Yeah, so I don't think you're alone in that. I think that
yeah,
can happen for people. And I know like for me, I just needed that initial test and I passed it, but
yep,
I have had friends that failed that first test. They
yep,
had to go back for that 3-hour test and that was like kind of intimidating, but then
hmm,
like it ended up not being that bad
yeah,
either. I do feel
yeah,
like we can kind of like build it up in our brains to be like, "Oh,
hmm,
it's gonna be terrible," and then you actually do it and you're like, "Oh, it's not that bad."
yeah. I think totally. I think it's one of those things that is just like feels scary. Oftentimes it is fine. There can be false positives with that initial test. So, like you said, you can need to go take that 3 hour test, and then everything is fine. Just because you don't pass that first initial test does not necessarily mean that you're going to have GD. So, there can be certain things that impact it. But they're really, I know some people will ask, like, do I need to do some type like special preparations for this and for that first initial test? There's no like special preparations. You don't need to fast for that one. You can try to really like aim for a nice balanced meal before you have that, and try to give yourself, like 2 to 3 hours for things to digest before you go and take your test. It might just help prevent any of, again, some of those like false positives. You may not want to eat like a straight pasta or something, right before you're going to eat that test. But, you know, the OGTT, that's the one that you're going to have to follow your provider's instructions, which is typically fasting for 8 to 12 hours before you take it. And they may
Okay.
have some like recommendations on, you know, what meals are specifically okay to have prior. Your provider will guide you there with that one.
Yeah. So say you like fail that first test, the like
Yeah.
original one, then you go do the 3-hour test and then you fail that one. Now what
Yeah.
happens?
Yeah. So typically, this is gonna, if you don't pass that second one, this is most likely gonna indicate gestational diabetes. So, if you're diagnosed, your provider should work with you to create a plan. Typically, they're going to refer you to work with a dietitian as well to help with meals, and this typically is going to include monitoring your blood sugar levels at home, making those dietary changes, and sometimes you may need medication or insulin depending on the person and how your body is processing things. Again, like we mentioned before, the good news is that most women that have GD are going to be able to manage this without any type of medication. Although you are going to need to really take your diet and those habits seriously. This certainly is not something to mess around with if you do get diagnosed. And I know changing healthy habits can be really challenging when you're in pregnancy. That's why we talk about a lot of times really get a nice solid foundation nutritionally ahead of time. But if you are in the thick of it, making those adjustments to help keep your blood sugar levels more balanced through your meals is something that is so important. So, if you haven't listened to any of my conversations on balancing blood sugar with your meals before, this is going to mean that you really want to pair your carbohydrate sources with protein, fiber, and healthy fats. Keep things simple for yourself and try to do the best that you can.
Yes. So could you give us an example of a balanced meal that includes that protein, fiber, healthy
Yeah.
fat, carbs?
Yeah. Yeah, absolutely. So let's do breakfast because it's important. But you could do two scrambled eggs, cook it in some olive oil or whatever your preferred healthy fat is. You could do a slice of whole grain toast, half an avocado. With that, we're getting some nice protein, fiber, and healthy fats. Avocado is nice little double dip option because you get both the fiber and the healthy fats in there, and that's going to definitely prevent you from having those blood sugar spikes.
Yeah, and that feels like easy to kind of pair those things together. Again, like something that maybe sounds overwhelming, but then when you actually look at an example, you're like, oh, okay,
Yeah,
that's not so bad. I kind of do that anyways.
yeah,
So what would be like your top dietary tips for someone who is managing gestational diabetes?
yeah. So I think the automatic thing that people are going to want to talk about first are carbohydrates, and it's not something that you have to completely cut out. You do want to be mindful of your portion size and also try focusing on those complex carbohydrates. So we want to try to swap out some of those refined carbs like white bread, like sugary snacks, and really, opt for more of our whole grains, legumes, the starchier vegetables. So, for example, if you are someone that eats white rice, you could opt for swapping quinoa. And this doesn't mean that you can't have white rice ever, but again, if we're dealing with GD, we're just going to be a little bit happier and preventing some of those bigger spikes when instead of having those simple carbs, we're adding more complex. Another one, like I said, add those protein and healthy fats to every meal. This is going to really help slow digestion and stabilize our blood sugar. So we're not getting those roller coaster type impacts. just a lot more steady. Again, here's another example. Like think about like grilled chicken with sweet potatoes and some like tahini on top. Again, we can keep things easy and you can still include foods that you like and enjoy, but are just going to keep things a little bit more even keeled from a blood sugar balance. I still want to have snacks in the mix, but instead of some of those more like packaged convenience foods like a granola bar, maybe we try opting for like a Greek yogurt with some almonds or granola. Um, and then another one I think that just like happens because we get busy is like skipping meals, or like maybe we don't feel best, so we just prolong it. But really trying to eat every 2 to 3 hours is going to feel a lot better for someone that has GD. Again, we're like preventing those like big drops and spikes. So aiming for 3 meals and 2 snacks is gonna, again, just keep everything a little bit more steady. Your water intake is also really key. And I know this can start to feel like boring. So, make sure you're including things like teas or infusing your water to give yourself some more variety during the day. And I think like hopefully those are just like tangible pieces that don't feel too overwhelming when you're thinking about putting your meals together.
Yeah, I think those are great things to focus on, easy to remember, like not going too long between meals, staying hydrated, thinking about protein and fat, looking for those more complex carbs. Like, I think that feels very doable. Now, one thing I know that a lot of people tend to like freak out about is fruit. So, how does fruit kind of fit into all this? What are your thoughts?
This question tends to get me like irritated because I think there's just so much like fear mongering around like fruit because it is a carbohydrate source, and fruits are fine in moderation. Like you can add these in again, just like with those other examples that we're talking about, is just try to pair them with some protein or fat. So if you're having an apple, like have some peanut butter with it, or if you're having berries, like have some cottage cheese or Greek yogurt. It doesn't have to be this like all or nothing spectrum when it comes to our nutrition. Like, even if you are dealing with something like GD, like, there is still a way to make, all things fit in a moderation.
Yeah, and one thing that you say that I don't know if you've said this yet in this podcast, but like making sure your carbs have friends.
Yes,
That's something
yes.
like I always just try to remember too, like even with things like
Yeah,
fruit, like an apple with peanut butter. I think that's like a really easy thing to remember and it can be really helpful.
yeah.
So, beyond diet, because I think you did a great job in covering all of that, what are some lifestyle changes that people can also implement that will help manage this?
Yeah. So this first one is really great for anyone, but definitely helpful for GD. But taking like a 10 to 15-minute walk after meals can really help with that digestion and lower blood sugar levels. So it can be as like easy, and this probably like helps towards movement goals that you talk about too, but just like breaking up your walks a little bit, going for like a 10-minute walk after like breakfast, lunch, dinner, if that feels doable. But that one can make a big difference. Stress is really key here. So, I know he says like, don't stress, like, you know, that's not helpful, but incorporating some activities that are going to be supportive of your central nervous system. So, even if you go like put your feet up above heart level for 10 minutes, doing some breathing, yoga, like whatever you find like helpful for you that manages that is great. And sleep is really helpful too. Like poor sleep can impact our insulin sensitivity. And I know that one's like easier said than done if you have other kids or you're dealing with like pregnancy insomnia. Do the best you can, but like aiming for 7 to 9 hours is really helpful. And just trying to have like some semblance of like a bedtime routine to again like just be as supportive of your body as it's going through these changes and challenges.
Yeah, and I think these are great reminders for everybody. some
Yeah.
gentle movement after eating, stress management, and sleep. Obviously, that benefits all of us, and even like into
Yeah,
motherhood. Like these are good things to remember, um,
absolutely.
whether you're pregnant or not. But those I think also feel doable. I mean, like you said, some of
That's
them
a
are easier
goal.
said than done, but
Yeah.
it's not anything outrageous. So, as we kind of start to wrap up this episode, we have one big myth that we need to debunk. So, sometimes people are like, I don't want to get gestational diabetes because I don't want to take insulin. Is this true? Or is this inevitable? I think, as we've discussed so far, it's not.
Yeah.
But when
Yeah.
is this the case?
Yeah. So yeah, not necessarily. Like we are saying, like generally like 60% of these cases can really be managed without needing medications, including insulin. So a lot of times we really can manage this if you are, willing to put in the effort with the diet and lifestyle changes. Insulin's really only needed if those levels are staying consistently high despite your efforts with making those changes. So a lot of times like you're able to like like again, like put in doesn't have to be perfect, but like put in some consistent effort with your diet and lifestyle, and that can really, allow you to not have to go on medication. A good chunk of the time. Our evidence-based research shows. Doesn't mean ever. Obviously, it's still needed in cases, but a lot of times we can avoid it.
Which is really reassuring. And hopefully, this episode so far has helped kind of relieve some of those fears for people if they are nervous about gestational diabetes. So, what would you say is your biggest piece of advice for someone who has been feeling a little nervous or overwhelmed if they just got diagnosed with gestational diabetes?
So take it one meal at a time. Like, don't feel like you have to overhaul everything overnight. Small changes are going to really add up. So, um, work through this at your own, don't wait too long, but like work through this at the pace that you feel comfortable with changes that do feel really doable. And you're not alone. Like, really like partner with your care team, lean on your support system to help you get through this and know that you can do this.
I think something else that can be helpful is like, this is just a small little, blip in time in the grand scheme
Yeah.
of things. Like you said, taking it one day at a time, really leaning on the support, and not letting it overwhelm you, I think can be a good thing. For anyone listening, if you are diagnosed with gestational diabetes and you do feel like you need some more support with your nutrition, be sure to check out Caitlin's one-on-one packages. She has worked with people who are pregnant who have this diagnosis, so she's a phenomenal resource. And I really hope that this episode has been helpful for you, whether you are currently pregnant, you have gestational diabetes, you're just thinking about getting pregnant, wanting to learn more about it. If you have questions for Caitlin, be sure to head over to our Instagram page, which is Vibrantly You Podcast. You can go to her specific page, which is Wholesome Huntress Nutrition. Ask any questions, and we will leave some additional information in the show notes for you as well. So don't forget to subscribe, share this episode with someone who might need it, and we will see you back here for the next episode.